It's Wellness Wednesday on the Rickey Smiley Morning Show.
All right, y'all, Rickey Smiley Morning Show is Wellness Wednesday, and all year we are working on our health and wellness. Joining us this morning is one and only Dr. MJ Collier. Good morning, Dr. Collier.
Good morning, Rickey Smiley, Rock T, Special K, Gary with the T, Maria Moore, and the Brat. And Rickey, thank you for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. So, Rickey, there was a women's health survey done that asked the question, what do you wish your doctor had told you about middle age? I'm going to answer a few of those questions. One, the fluctuating hormone levels in the late 40s and early 50s will take a toll on your health. Menopause is officially defined as going without a menstrual period for 1 year. And the average age of menopause in the United States is 51. Now, that may vary in your family. Ask your mother what age she went through it, and if you have older sisters, ask them what age they went through it. So, Rickey, women ask, what's happening to my body? Number one, you will get a belly. You may have always had an hourglass shape, but you're in for a rude awakening. You can eat the same foods and exercise the same as you always have, but your waistline still begins to grow. Why? Estrogen signals the body to store fat in the breast and the buttocks and the thighs. That basically is to prepare you for a pregnancy. After menopause, the estrogen levels go down, and you will notice a shift in your fat distribution. More fat is stored in the belly and not in the hips. Two, you will gain weight. Women gain 1.5 pounds average per year between the ages of 50 and 60. That's 15 pounds minimum. This does more than make it difficult to button your jeans, Rickey. This increased belly fat increase your cardiovascular risk and your risk of diabetes. Three, you'll have changes in your sexual health. You may have had that fire, but now you got a little flow-through or nothing. With decreased estrogen levels, the walls of the vagina will not be as moist or as thick, which can make intercourse less pleasurable or even painful. Rickey, you can treat all those symptoms with supplements that enhance natural estrogen production. You can get estrogen replacement, or you can get bioidentical hormone replacement therapy. So, ladies, there are ways to address these issues. So, let's go to the listeners and see what kind of questions they have about their health.
All right, let's go to the phone, y'all. Dr. Collier, good morning.
Hi, my name is Monique. I'm calling from Houston, and my question would be, what type of vitamin is good to take if you've had gastric sleeve surgery?
Okay, if you've had gastric sleeve surgery, it's difficult for your body to absorb a lot of the regular vitamins. So a complete multiple vitamin with iron and minerals. That the key phrase in that is complete. A multiple vitamin will only have multiple vitamins. It can be one, it can be five, it can be, but you want something, one tablet that's got everything in it. It doesn't require you to have 5 bottles of various different types of vitamins. So a complete multiple vitamins such as one a day for women, Centrum, Z-Bec, anything that has that criteria on the label. Now, lastly, there's no such entity as a generic vitamin. A vitamin is a fixed chemical formula. There's no better way to make it. So if you need to take a complete multiple vitamin and it says, you have a store brand, it says compared to the brand, then get the store brand. It's the exact same formulation. If you spend more than $14, $15 for a bottle of 100 vitamins, you're paying for a pretty label and a celebrity endorsement.
All right, y'all, with Dr. Collier, good morning.
This is Marquita. I'm calling from Lakeland, Florida. My husband and father-in-law have hypertension, but it's based on their kidney numbers, and they both are on a hypertension medication, but their blood pressure number seems to fluctuate. I wanted to ask Dr. Collier, is there any other type of home remedies that they can try to kind of bring their blood pressure down?
The main thing for that, particularly if you have hypertensive kidney disease, is to monitor your sodium intake. So it's very important that they decrease the amount of salt that they're taking in. And more importantly, something as elegant and simple as drinking more water. I tell all of my patients, everybody says I drink enough water, but they don't. You need to drink 8 to 10 glasses of water on a daily basis just for maintenance. So if you have diabetic kidney disease, that's indicated by a thing called the glomerular filtration rate, or GFR. When that number goes too low, it should be 60 or higher. It's an indication that your kidneys are not effectively and efficiently filtering your blood. So you drink more water, you have more fluid to filter, the rate of filtration goes up. But they also need to make sure that their blood pressure stays controlled. It may require them to be on 3 to 5 different medications to control it, but whatever it takes is what they need to do. But sodium, decrease the amount of salt that they're taking in, drinking more water, and taking all of their blood pressure medications as directed.
All right, gentlemen, Dr. Collier, good morning.
I want to ask him, I have extremely bad itching feet. There's no kind of marks on them that would indicate a rash or anything, but sometimes they just itch real bad.
Okay. Oftentimes, itchy feet is a subclinical fungal type infection. I would use a shampoo like Selsun Blue on my feet when I'm in the shower, but I also would apply an antifungal cream. There's one that's available in the store where everything used to be $1. It's called chlorotrimazole, but it just says on the tube antifungal cream. Just use that like lotion. Make sure the feet are not dry because dry skin itches no matter what, and that should take care of it. If there's no rash, then that should clear it right up.
You know where you can get that cream from?
Exactly.
The Dollar Tree.
The Dollar Tree. That's what I'm saying. You can get it at the Dollar Tree.
Are you serious? Are y'all playing?
You can.
Antifungal cream from the Dollar Tree?
An antifungal cream. You can get anti-itch cream, antifungal. They have a whole pharmaceutical section, Ricky, that's $1.25 for every product, and some of these products will cost you $20 or $30 in your regular pharmacy. So I literally buy them by the basket full. Everybody asks when I go there, they say, "What are you doing that for?" I'm putting them in my office and giving them away to patients.
Yeah, you told me about that about a month ago.
A man don't feel comfortable rubbing her feet because her skin peeling.
Actually, Ricky, one last thing about that. She could actually be having an allergic reaction to her tennis shoes. Sometimes the chemicals that go into your sneakers can irritate feet. Some of them have formaldehyde in the covering, and that can irritate your feet as well. So if you're going barefoot or you're not wearing thick enough socks or even footies in your shoes, then it could be that. You might need to. It might be one pair of shoes that's doing it. You just need to get rid of that one pair of shoes.
Go ahead. No, go ahead. Go ahead. You on it?
Okay, I was going to say, I can be reached on all social media at Ask ASKDRMJ. Go to Ask Dr. MJ, also my YouTube channel, where you can see videos on various healthcare topics. Go to my website, lipodrops.com, for information on supplements like my new LipoHers. LipoHers, that's the ladies' equivalent of the Lipo-T. This modulates symptoms of low estrogen, enhances sexual response, and intensifies your orgasm. So, ladies, if you want that fire, get that LipoHers. All right. Damn. These are the opinions of Dr. MJ Carr here, not those of Rickey Smiley, the Rickey Smiley Morning Show cast, or its production crew. Again, you can reach me on all social media at ASK Dr. MJ. Go to lifewithdrops.com and stay. Don't you dare go away. You listening to Dr. MJ on the Rickey Smiley Morning Show.